In this series of videos, we'll discuss how to combat weight bias and stigma in your research, clinical practice, and everyday experiences. We have 3 learning objectives for this topic. This video will teach you about how to analyze and correct potential nonverbal sources of weight-related stigma. There are many nonverbal ways to show respect and concern when working with patients with larger bodies. It is important to consider what physical needs individuals with larger bodies may require to feel comfortable when visiting your office. When our spaces are not inclusive of all body shapes and sizes, we run the risk of making individuals with larger bodies feel uncomfortable in our spaces and interactions, which will decrease their ability to be open to learn from and work with us to develop and meet their health goals. These nonverbal cues can be expressed through our marketing and educational materials, the design of our waiting rooms and clinical spaces, and the capacities and sizes of our equipment and supplies. Let's talk through each one of these issues. We want to make sure that the images in our marketing and educational materials don't only feature thin white people. Ensure that you are featuring a diverse array of bodies and individuals to make sure that your messages are inclusive and relatable to the real people with whom you work. We also want to make sure that our waiting rooms are comfortable places to wait so that patients are not uncomfortable, embarrassed, or angry by the time they reach your office. Small chairs with arms or narrow walkways may make individuals with larger bodies uncomfortable or highlight the, quote, inappropriateness of their particular body shape or size. Instead, design your waiting room with armless chairs and ample walking spaces, so no one is made uncomfortably aware of how their body shape or size may differ from others. This helps to welcome all patients into your office in a way that is inclusive and comfortable. We want to make our exam rooms equally comfortable and inclusive by ensuring the seating and exam tables are large enough to hold a diverse array of body shapes and sizes. These spaces can already trigger insecurities and self-consciousness, and it is our responsibility to minimize these feelings as much as possible to help our patients feel comfortable, supported, and ready to work with and learn from us. Similarly, we want to make sure our spaces are equipped with body-inclusive equipment and materials, such as high-capacity body weight scales and large-size blood pressure cuffs and gowns. This improves our ability to accurately assess health markers and ensures that we aren't making our patients feel shamed about their body shape or size. Taken together, this video emphasizes the importance of analyzing the contexts within which we work with and educate others to ensure they are inclusive and comfortable. Our biases can be communicated nonverbally, and we should analyze and correct these nonverbal sources of bias that may arise. We can evaluate our marketing and educational materials, our waiting and clinical room designs and furniture, and the capacity and size of equipment and supplies we have in our offices. Efforts to identify and correct biases in these spaces are important because patients and clients learn best and engage best when they feel comfortable and welcome in a space. That's all for this video. Thank you for learning with me.